Today is match day. What does that mean? Well, that is the day when all the fourth year medical students find out where they're going to be doing their residency. Probably the most important day of a medical student's life. Let's talk a little bit about what that means. So, how do you become an orthopedic surgeon? Well, you go to medical school, and then during your fourth year of medical school, you apply to get an orthopedic residency. So you fill out an application. They want to know what your step 1, step 2 test scores are. They want to know your class rank, essentially your GPA. They want to know if you've done any research, if you've done what's called an audition rotation, which means you've done maybe a 4-week rotation at a different hospital or different location where there's an orthopedic program that you want to go. They would like to get letters of recommendation. You put all that together in an application. You then will submit your application, and the different orthopedic residency programs will then ask you to come for an interview. It's actually even hard just to get an interview for an orthopedic residency. So you get an interview, you go, you talk about why you want to be an orthopedic surgeon, you go over your application, etc. And then there is a computer rank. So you will rank which program you want to go to. The orthopedic program will then rank which applicants they want, and then the computer will match you. So you will find out if you're going to, for example, the University of Minnesota, or are you going to Harvard? It just depends where you've interviewed, if they like you, if you like them, and then you rank them, and the programs rank you, and then a computer will match you. Orthopedics is very competitive, so depending on which year, 55 to 60% of the people will match, the medical students will match. You'll have 35 to 40% of the medical students that don't match, they don't even get an orthopedic residency. So then what happens is you have to scramble to try to find either a spot that is open, which is quite rare, or you need to pivot and go into a completely different field. So on match week, on Monday, you find out that you've matched or you haven't matched. If you haven't matched, then you start scrambling, looking for maybe an anesthesia position or a radiology position or family medicine or some other residency that has positions available. Then on Friday, which is today, you will find out where you go. You have no idea, but you will find out, I believe it's at like 10:30 on Friday morning, you will find out where you've matched. Best of luck to everybody out there.